Hello, I'm Jennifer Barrera Wandry, Associate State Director of Outreach and Advocacy for AARP Texas. Thank you for joining us today. I want to welcome you to this important discussion about caregiving. AARP is a nonprofit, nonpartisan member organization that has been working to promote the health and well-being of older Americans for more than 60 years. Today, we will hear from Veronica Segovia Bedon, Program Management Director for Caregiving and Health Education at AARP. Veronica leads educational design efforts to improve health outcomes for older adults and works across departments to ensure support for caregivers through policy, education, and advocacy. We will also hear from Andrea Williams, Chief Program Officer at Care Partners. Andrea brings extensive experience in community-based caregiving, support, and health education. Finally, we're joined by Jorge Olvera, Director of Community Engagement at the Alzheimer's Association, Houston and Southeast Texas. Jorge works closely with families affected by Alzheimer's and dementia, helping connecting them to vital resources and support. For new Townhall participants, the format is similar to a radio talk show. You'll have guests share insight and the opportunity to ask us questions live. For those of you joining us on the phone, if you would like to ask a question about caregiving, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in the queue to ask your question live. If you're listening through our online audio stream, please leave your question in the comment section. We have folks join our call while I have been speaking, and I want to extend a welcome. I'm Jennifer Barrera Wandry with AARP Texas. Thank you for joining this important discussion on caregiving. Now we'll hear from Veronica Segovia Bedon from AARP. Thank you for joining us today, Veronica.
Thank you so much for having me. As you mentioned, I'm Veronica Segovia Bedon, and I serve as Program Management Director for Family Caregiving at AARP. It's an honor to welcome you today as we come together to focus on an issue that touches nearly every family, caregiving. At AARP, we recognize that family caregivers are the backbone of our communities. Every day, millions of people step into this role, often independently or unexpectedly, and providing care that enables our loved ones to live independently and with dignity. And this work is deeply meaningful, but it can also be overwhelming, financially challenging, and isolating. And it's why AARP is committed to making caregiving easier and more sustainable for families across the country. Our caregiving work is grounded in 3 guiding principles. 1 is to make navigating resources and the care system easier for family caregivers. We want family caregivers to spend less time searching for help and more time caring for their loved ones and themselves. 2, we want to reduce obstacles and barriers to that self-care. Caregivers often sacrifice our own health and financial security. And so AARP aims to remove those barriers, whether it's related to workplace flexibility, financial strain, or access to support. And the 3rd guiding principle is to prioritize those of us who are most vulnerable, those of us who are first-time caregivers, and those who lack adequate resources today. These individuals need practical tools, we need emotional support, and we need clear pathways to solutions. These principles drive everything we do at AARP, from advocacy and education to partnerships with employers and community organizations. Our goal at AARP is to make sure it's simple, that by 2030, the 50 million family caregivers in the U.S. will face fewer challenges that lead to financial insecurity and poor well-being. And I should say the 63 million, because we have new data that the 50 million family caregivers have increased to 63 million. So thank you to all of you for being a part of this conversation. Together, we can create a future where caregivers feel supported, valued, and empowered. I look forward to working with all of you to make that vision a reality.
Thank you, Veronica. And as you just mentioned, Recently, AARP has released the Caregiving in the U.S. 2025 report, which, as you mentioned, shows that 63 million Americans are now family caregivers, a 45% increase over the past decade. Can you share some of the key findings from this report and what they reveal about the evolving needs of caregivers today?
Absolutely, yeah, and I tripped up on it because I'm so used to saying 50 million, but the Caregiving in the U.S. 2025 report produced by AARP and our partners at the National Alliance for Caregiving offers the most comprehensive snapshot yet of America's caregivers. And the findings this year are striking. First, caregiving is absolutely a universal experience. In 2025, 63 million Americans, 1 in 4 adults, are providing ongoing care to someone with a chronic illness, disability, or age-related need. That's an increase of 20 million caregivers in just a decade, underscoring how rapidly this role is expanding. Second, caregiving intensity is rising. Nearly 45% of caregivers describe their situation as high intensity, meaning we're managing complex medical tasks, coordinating care, and often doing so for years. In fact, 30% have been caregiving for 5 or more years, which is up significantly from previous reports. 39% are sandwich generation caregivers, caring for an adult and a child under the age of 18 simultaneously. And financial and emotional tolls are profound. Almost half of caregivers report major financial strain, including debt and loss of income. Emotional stress is equally concerning. 2/3 of caregivers experience moderate to high stress, and 1 in 4 reports feeling isolated or alone. These pressures are even greater for those of us who might be living in rural environments and rural communities, and those juggling both children and adults. Working caregivers also face unique challenges. About 70% of caregivers who are working age between the ages of 18 and 65 are working full-time, and many struggle with limited flexibility and benefits. While access to paid family leave has improved, now reaching around 50% of working caregivers, when this is up, we're seeing an increase from 2015, there's still a really long way to go to make workplaces truly caregiver-friendly. And that's especially true for the 18 million hourly wage workers who are caregiving. And finally, the report highlights policy gaps and opportunities. Where you live matters. States with strong supports like paid leave and respite care report better outcomes. And this reinforces the urgent need for federal and state action to strengthen financial supports, integrate caregiver training into healthcare systems, and expand home and community-based care options. And I'd be remiss if I don't talk about what the data says about caregivers in Texas. This report shows that 5.3 million adults in Texas are family caregivers, about 23% of the state's adult population. 94% care for an adult, most often a parent. 21% care only for a child, and that child likely with complex medical needs. The average caregiver age in Texas is 47. The average care recipient age is around 65. And the gender breakdown, 54% of caregivers are female, 46% are male. And then if we want to break it down a little bit further into race and ethnicity, around 42% of caregivers are within or identify as Hispanic Latino, 37% as white non-Hispanic, and 13% African American or Black. So I'll leave you with that. And one thing to think about too is this sandwich generation. Those of us who are caring for an adult and a child under 18 simultaneously, and also that our data shows 15% of caregivers are living with a disability themselves. So in short, caregiving is no longer a niche issue. It's a national reality shaping our families, workplaces, and healthcare systems. And these findings call for bold solutions to ensure caregivers have the recognition, resources, and support they deserve.
Thank you, Veronica. All of this is wonderful data, and specifically, the Texas numbers is good to see all of that data in one place. So what are some resources AARP offers to support new caregivers who may be feeling overwhelmed or unsure of where to start?
I love that question. Thank you for that. You know, becoming a caregiver or stepping into or realizing that you're in a caregiving role can feel very overwhelming, especially when you're unsure where to start. So at AARP, we understand that this journey is deeply personal. It's often unexpected. We've built resources to make it easier for you to find support, guidance, and some peace of mind. So first, our AARP Caregiving Resource Center at aarp.org/caregiving and aarp.org/local caregiving really serve as a hub for everything you need. It's where you'll find practical tools like the Prepare to Care Planning Guide, which can help with organizing conversations, documents, and care plans. We also offer a family caregiver resource guide and financial workbook for family caregivers, available in multiple languages and tailored for different communities. And you can also find resources in Spanish at aarp.org/cuidar. Second, we also provide state caregiver resource guides. So those can be found at aarp.org/caregiver resources. You can start there by finding that state-specific guide for Texas to see what caregiving resources, information, and events are available in your state and community. We also host webinars or teletown halls like this one. We also have guides and free how-to videos for caregivers who are, in charge of medical or nursing tasks that can support you. And that can include videos around special diets, caring for someone with incontinence, how to manage wound care, how to do, care for someone who has limited mobility, and how to manage medications. Those videos are available in English and Spanish at aarp.org/no-longer-alone. We also have caregiver resources for mental health and care for oneself as a caregiver. We have a new guide that came out this year, the Care for the Caregiver Guide, and it's a key AARP resource designed to support family caregivers in maintaining their own well-being while caring for others. And it offers self-care, right? Tips on how essential self-care is. It really emphasizes that self-care is not selfish and it's not optional. It's critical for sustaining your ability to care for others. So it addresses physical, mental, emotional, and financial tolls of caregiving, and it also provides actionable strategies to manage stress and prevent burnout. It has 5 practical tips on how to care for yourself and how to integrate wellness into your daily life, even when time and energy are limited. And that can include how to set boundaries, how to find respite, and how to leverage resources in your community. It also goes over warning signs of mental health crisis, guidance on recognizing signs of anxiety, depression, and even suicide risk, along with steps to help promptly ahead of getting into crisis mode. And there are special sections for veteran and military caregivers, tailored resources for those supporting service members, including links to specialized programs and benefits. And you can download the digital version of the Care for Caregiver Guide at aarp.org/care for the caregiver.
Thank you,
and
Veronica.
So I would, yeah, absolutely. And I just want to mention too, one last resource that may be helpful, which is our Facebook support group. So if you're on Facebook, there is a family caregiving Facebook group that you can find. It's the AARP Family Caregivers Group. It's free to join, and caregivers across the nation are there connecting and sharing support, tips. They're discussing their caregiving experiences and helpful resources. And we find that, that sense of community is really helpful for caregivers, especially those who are new or feeling overwhelmed, to combat that loneliness that can happen when you're a caregiver taking all of that on. Thanks, Jennifer.
Yeah, thank you, Veronica, and thank you for sharing all this wonderful information. And just as a reminder, all these resources are completely free. You do not have to be a member to take advantage of them, and are available to download and print out yourself or request copies of them. So thank you, Veronica. If you're just joining our call, I'm Jennifer Barrera-Wandry with AARP Texas, and this is a live telephone town hall to talk about caregiving and caregiving resources. Joining us are Veronica Segovia Bedon with AARP, Andrea Williams from Care Partners, and Jorge Olvera from the Alzheimer's Association. As a reminder, this is an interactive call. If you would like to ask a question at any time during the call, Just press star 3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in a queue to ask the question live. The sooner you press star 3, the sooner you will be online with our guest experts. Now we'll hear from Andrea Williams with Care Partners. Thank you for joining us today, Andrea.
Thank you for having me. As Jennifer said, my name is Andrea Williams. I'm the Chief Program Officer at Care Partners. At Care Partners, our mission is to provide care, education, and support to older adults, including those with dementia and their family caregivers, helping families to stay connected, informed, and supported every step of the way. We do that through several programs. Our Gathering Place program, which is a monthly half-day program offered at over 40 locations throughout Houston. It provides people living with dementia a chance to connect, engage, and socialize while giving their family members a much-needed break, all while being supported and engaged by trained volunteers. Our Second Family program provides in-home respite through trained volunteers that visit families to offer companion and support at home, also for support for older adults who just need some companionship. We also offer support groups called Common Ground support groups where peers are able to really connect and caregivers are getting that experience and support from others walking a similar path. We also provide education programs and conferences which give practical guidance and resources from subject matter experts to help family caregivers navigate caring for older adults. And where else in the world can you get free advice from a lawyer providing legal and financial support or just understanding how to better care for yourself as a caregiver? We also offer the Dementia Day Center, which is the first Dementia Day Center in Houston and the only one that provides support to individuals living with early to moderate late dementia. We have trained staff offering enriching activities and holistic support. This is our only fee-for-service program, and it's designed to provide structured daytime care and meaningful engagement for people living with dementia. All of the programs meet families in different ways, but what really ties them together is our care consultation service. Care consultation is ongoing one-on-one conversation with a trained professional, someone who understands caregiving and can help families think through next steps, find resources, and talk through challenges. We provide these consultations over the phone. They can be done virtually via Zoom or in person. They're convenient for busy caregivers, and they're also offered in both English and Spanish.
Thank you. And just expanding a little bit more on the care consultation service, is this available to anyone, anywhere? And what does that consultation look like? Is it, I think you mentioned it's at no cost, but if you could just reconfirm those details, and how do we get a hold of the consultation service?
Yes, our consultation program is at no cost to families, and families can call us or they can reach out to us at Care Partners Texas. Texas is spelled out .org, so it's Care Partners, all one word, Texas.org, and Texas is spelled out, or they can reach us at 713-682-5995. Our care consultation program, it's really more than just connecting these families to services. It's about creating a safe place for them. Caregivers are able to connect. They're able to plan and take ownership of their caregiving journey with the support of another individual. A quick example of that is we are working currently with 3 cousins who are caring for an aunt with dementia. 2 of them live locally and 1 lives out of state. They meet once a month on a call with our care consultant or with their care consultant. That call gives them dedicated time to discuss their aunt's needs, coordinate responsibilities, and plan together. It helps them to stay organized and to feel connected and make sure their aunt's care is consistent no matter where they are. And so that's really, I think, one example in the heart of our care consultation program is that it's really connecting these families to the right services. It's supporting their decision-making, which is sometimes hard and overwhelming for families when lots of things are thrown at them. So it's helping them to prioritize and really figure out what's most important. And then it's a safe space for them to navigate caregiving together, to share what their fears are, but also to get some facts and to action plan when needed.
Well, thank you so much, Andrea, for sharing all this wonderful information and this resource. Do you mind repeating that phone number again in case anyone might have missed it?
Sure. Our phone number is 713-682-5995, and our website is CarePartners Texas. Texas is spelled out .org.
Thank you so much. So as a reminder, this is an interactive call. If you would like to ask a question at any time during the call, just press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in a queue to ask your question live. The sooner you press *3, the sooner you will be online with our guest experts. Thank you for joining us. Today we have Jorge Olvera. How are you, Jorge? And if you'd like to introduce yourself.
Thank you, Jennifer, and hello to everyone on the call. It's great to be here. Thank you to AARP for hosting this Town Hall. My name is Jorge Olvera. I work for the Alzheimer's Association, where our vision is a world without Alzheimer's. So the Alzheimer's Association leads the way to end Alzheimer's and all other types of dementias across the world. We do it by accelerating global research. We drive a lot of risk reduction and early detection practices, and also try to maximize quality care and support for all of those who are caregiving in any format. We fund global research, as I said. We have been behind many of the latest discoveries around treatment and early detection. We live in a very unique time because we now have treatments for slowing down the progression of Alzheimer's disease when identified early. We've only had that treatment for the last 2 years, even though this disease was discovered 116 years ago. We also now have FDA-approved blood tests to help us identify Alzheimer's disease earlier, thereby giving us more time to make decisions. We also drive risk reduction and early detection, to some of these formats, and we support caregivers across the United States. We're a national organization where a person may be living with Alzheimer's disease in Texas, for example, and their loved ones are living in a different state or perhaps in a different country. But we have a 1-800 number that they can call 24 hours a day, 800-272-3900, from anywhere in the world to get resources. And if they're in the United States, there is a local chapter of the Alzheimer's Association in any of the 50 states that can provide you the same care and support that you're going to get at any of the other chapters across the country. So if my mom is living in Houston, Texas, and I live in New York, I am able to get those resources and join a caregiver support group, even though I'm caregiving from afar. So that's what we do at the Alzheimer's Association, and it certainly is exciting to be here with you all.
Thank you, Jorge. And I know you just briefly touched on some of the resources that y'all provide. Is there anything in addition to that you just mentioned that help support caregivers in their journeys?
Yes, of course.
Help their family navigate. Mm-hmm. Yes, sorry.
I would say that the biggest tool in our arsenal, if you will be that 1-800 number that's available 24/7. And so when you have a question about caregiving and it's 3 a.m. and you're trying to figure out how to overcome whatever situation you may be going through, you can call that number. You may also call because you're worried about a loved one or you're worried about yourself and you're looking for a caregiver support group. We have them virtually. We have them in person across the country. We have caregiver support groups in multiple languages. We have caregiver support groups for specific groups. For example, we have an LGBTQ support group that meets online, and that is a caregiver support group for those who want to be with others like themselves, right, who are going through a special situation and are part of the community. We have African-American support groups, Spanish-speaking support groups. We have male-only support groups. And so there's a multitude of ways that you can get connected and find that space where someone can help support you. We actually also have a adolescent and maybe preteen and teenager caregiver support group. We all know that when there are multiple generations in the household, those children and adolescents oftentimes have to take on extra responsibility around the home to caregiving for a person living with Alzheimer's disease in the home. And so we have a support group for them. We have to encourage, everyone in the household to really care for themselves. And so our biggest arsenal is those support groups that we have available, as well as that 1-800 number.
Okay, well, thank you. And to get connected to the support groups, is it just call the number and they'll connect you, or how do we go about that?
That is correct. If you call the number 1-800-272-3900, you can get connected to your local chapter. If you want to do an in-person support group, you can get connected to a virtual support group. But all of that information will exist there on the 1-800 number.
Thank you so much, Jorge. We appreciate you being here today. So as a reminder, this is an interactive call. If you would like to ask a question at any time during the call, just press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue to ask your question live. The sooner you press *3, the sooner you will be online with our guest experts. If you're listening through our online audio stream, please leave your question in the comment section. We'd now like to hear from you all. Let's go to the phone lines and the audio stream. What's at the top of the caller's mind today? So to help us manage the question queue, it's my pleasure to be joined today by AARP Texas Associate State Director of Outreach and Advocacy, Liliana. Liliana will help facilitate your calls today. Welcome.
Thanks, Jennifer. I'm happy to be here for this important discussion. Let's take a few questions from our callers. I'm going to go with, James, or I believe that it's Bob. Bob, I'm going to put you live. Please ask your question.
Hi, good morning. My question is regarding, I've been looking for lack of a better word, a caseworker, someone that can help me navigate through insurance, Medicare resources. There's got to be some things out there that I'm just not aware of to help. I'm the sole caregiver for my wife, and it's a 24/7 job, of course. And I've asked all the doctors, the neurologists, and the general physicians, and they don't have any direction on that. So I'm trying to find somebody that can help navigate the options that are available.
Thank you, Bob. Let's see, I don't know, maybe Veronica can take this question, or?
Sure. So I noticed I can still hear Bob. He's not on mute yet. I'm curious if you work or if you are retired right now, Bob. The reason I asked that question is because certain employers are now recognizing the impact of caregiving on their employees and, their ability to, remain productive employees, right? And so, for example, through our employer benefit where I work, I actually have access to a navigator up to a certain amount of hours through a program that is provided by one of our healthcare providers. And I actually don't have to be enrolled in that healthcare program. I'm actually on my husband's insurance, but I still have access to a caregiving resource, a caregiving navigator. And so I would ask or encourage you, if you are employed, to check in with your own HR department, or if any of your relatives are working and helping you, even if it's tangentially, this could be something they help with in terms of access to employer benefits that provide navigation. And then second, I would recommend taking a look at some of our financial and legal resources. And then also figuring out, I didn't hear specifically the condition that you are looking to find the care for. However, if the care recipient is on Medicaid or Medicare, there are some additional supports for people with dementia. And so and by that I'm talking about the Medicare program, the GUIDE model through CMS, GUIDE. And if you Google that, if your care recipient is a Medicare beneficiary, you can find a 24/7 number that you can call and ask for care, ask for guidance around navigating coverage for care. So those are two ways that I would recommend. And then I'm curious if you're caring for someone with Alzheimer's, if our friend from Alzheimer's Association, Jorge, might have some other resources that Alzheimer's specifically connects people to when they're trying to figure out how to pay for care.
Thank you. I was waiting for you to finish because I did have a couple of things that I wanted to share. And, the short answer is yes. If you call the number that I shared with you, which is our 1-800 number, that's a national number, and that's where you can get some support from the Alzheimer's Association if it's specific to Alzheimer's disease or another type of dementia that you're doing the caregiving. I also want to encourage you, and I said the 1-800 number because I don't know where you are. If you were local in Texas where I am, that service may look different. But this is certainly state by state what kind of support is there. But for sure, the 1-800 number, which is our national number, can get you there. Second, I wanted to encourage you to search your local area agency on aging. This is a program that your state might have access to, and so maybe support that may be close to where you are if you're in a major city. I know that area agencies on aging usually have an office in some of the major cities across the country where you could also get support from them. So I just want to give you those two resources.
Yeah, and one last thing that we also have on AARP's website is at aarp.org/caregiving/long-term care. You can gain a better understanding around long-term care and breaking down sort of expert advice and information around navigating long-term care options. So I just wanted to make sure that I offered that too. Thank you. Thanks for letting me add that.
Thank you, Veronica. And Andrea, is there, with Care Partners and your guys' guidance, do you guys offer anything related to this question?
Yes, we would be able to provide some general information. I was going to do the same as Jorge and refer you to your local area agency on aging and refer to the local area agency on aging. So, yes, our care consultants could help provide some guidance, but the area agencies on aging typically have benefits counselors who can help you to walk through some of those very specific questions you may be asking.
Thank you. Liliana, do we have any more questions on the queue?
We do. Carrie has a question, and Carrie, if you're still on, we're going to put you on live.
Hello, this is
Carrie. Go ahead, ask your question. Yes, ma'am.
Can you hear me?
Yes, ma'am.
Okay, yeah. Simple question. Is the Care Partners organization only in Houston?
Hi, yes, we are in the Houston metro area. So we serve 3 counties around Houston, Montgomery County and Fort Bend County, as well as Harris County. But we're pretty local to the Houston area.
Okay.
Andrea, and can you, sorry, real quick, Andrea, just to clarify though, that the call center you can be anywhere.
Yes. If you are interested in care consultation, you can be anywhere in the state. Or in the world, really, to receive the care consultation services.
Yeah, that was actually my question as well. Thank you.
Yeah, you're welcome.
Thank you. Liliana, any more questions?
Yes, we've got one more one more question here from Barbara. Barbara, so please ask your question.
Yes.
Barbara?
My husband has dementia. For a time, we thought maybe he had Alzheimer's, but a PET scan showed that he does not, which is wonderful. But during this time, I've had a need for counselors for myself, and I've had difficulty finding counselors that accept Medicare. My psychiatrist said she has some, but I'm just wondering in general where you would find a resource for that.
Hey everyone, this is Jorge again from the Alzheimer's Association, and I know I sound like a broken record, but I want to encourage you to call the 1-800 number because they'll be able to do some referrals. We also have, and I'm blanking here, and Jennifer, maybe someone from AARP can help me with this. There is a website in partnership with AARP, with the Alzheimer's Association, where we provide resources. Is it communityresource.org, perhaps? Jennifer or someone from AARP, you can correct me on that. The website where you can find local organizations, including neurologists and other caregiver supports.
Yeah.
Can someone correct me on that website, please?
Yes, this is Veronica, again, with AARP. And that website, you can find it easily at aarp.org/CRF. And that's CRF for Community Resource Finder. And that actually connects you to a lot of different resources in your local community. And then I just want to offer you also, at the national level, we've been having conversations with NAMI, which is the National Alliance on Mental Illness. And NAMI has a Texas footprint. So they have a Texas chapter. If you look up NAMITEXAS, so namitexas.org, and you can take a look and actually find some counselors. And by counselors, I'm guessing you mean a therapist, someone you can talk with about, just how much caregiving is. I see a therapist. I'll be vulnerable and share with you all. I pay out of pocket for my therapist because she doesn't accept insurance. And so I put money aside every year in a budget so that I can see her and talk with her at least 10 times a year. And that's something that I have the privilege and benefit of doing. It's now open enrollment season. Another thing I would recommend is calling Medicare and to find out who is in network for talk therapy in your area. And it's possible that they may have someone who does telehealth appointments. I'm not sure how comfortable you are with telehealth resources for therapy and counseling, but I would, just personally, I can't say this, AARP gives general guidance and we do not give medical advice. I am not a doctor, but as someone who is a recipient and benefits from talk therapy and counseling and has for many years, I would recommend calling Medicare to get a list of people who are in network for you. I know firsthand just how helpful it can be to have someone to talk to, a licensed professional to talk to about caregiving.
Thank you, Veronica. As we proceed, please remember, if you would like to ask a question, press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question. The sooner you press *3, the sooner you'll be online with our guest experts. Liliana, do we have any more questions right now?
Yes, we've got a question from Jocelyn Gutierrez. She wanted to ask in foreseeing something, what does a typical day look like for someone who is a caregiver?
Hi, this is Andrea from Care Partners. I will say that there probably isn't a typical day for someone who is a caregiver, and from what we understand from our conversations with caregivers. We do know, however, that as Veronica mentioned earlier, that caregiving can be pretty isolating for family caregivers, especially those who are providing additional support to others in the household. But it really will just depend on the caregiver and the person that they're caring for.
Thank you, Andrea.
Thank you for that.
Any more questions?
Yes, we've got a few more questions that came in online. So what tools can folks really use and strategies to help them stay organized? I don't know if that's a question for Veronica or Jorge or all three.
Can you repeat that question one more time for me?
What tools or strategies can be helpful for a caregiver to stay organized?
Yeah, so it really depends on the caregiver. A lot of times what we're seeing now is, as much as we want to design like an all-in-one tool for someone, and we've tested those kinds of things. If you Google aarp.org/CareConnect or just Google AARP Care Connect, that is actually something that we've been really testing is like, how can we put everything in one place for a caregiver to stay organized? And oftentimes the feedback we're hearing is, caregivers or care teams, like me and my sister, for example, we actually do a lot better just texting back and forth, sharing notes apps in our cell phones, shared drives, like digital folders have been really helpful because, at this point, my dad is 93 and my mom is 78. And my mom has always had my whole life some chronic issues that we've had to all shoulder and help with the care for her. And so with us, it's really some of these digital tools that are helpful. I'd say my sister and I, I'm 43, my sister's 41. I have young children also, so sometimes WhatsApp threads have been helpful for us in terms of, just connecting with family who don't necessarily live in the same state as my mom, and even the same country. My parents are both from Paraguay in South America, and so communication is really key for all of us, and finding ways to really delegate tasks so that everyone feels like they're contributing and pitching in. That can be really helpful and go a long way in our family. But we do offer toolkits and guides, tangible things that you can keep at home, like in an accordion folder for yourself. And so that's why we talk about these care guides that we offer. And we also have something called a home fit guide that can be helpful for people who really want to figure out how to make the home safer to navigate as their care recipient may want to or prefer to age in place in their own home. And so that home fit guide is also really helpful. It's a booklet and it has some checklists in it, the same way the caregiving resource guides at AARP that AARP offers have checklists. And then our financial workbooks also have checklists. And that's the same for our military caregiving handbooks as well. We also have handbooks that include checklists where people who might prefer to have pen and paper and save and keep something like a checklist in a safe space where everybody knows where that is, so that anybody who needs to access it can access it. We find that people really like those as well. So I would say it depends on the caregiver, but there are some all-in-one options, especially if the care recipient is requiring or is open to in-home health care, and keeping track of the people who are coming, the paid caregivers who you may be hiring to come in and out of the home. Keeping track of that kind of care is also helpful in a tool, in a digital tool like AARP's Care Connect. I mean, I'll open it up for my colleagues on the call to also share something they've seen or what they've been hearing.
Yeah, this is Andrea again from Care Partners, and like Veronica said, it's really individualized and personal. So one of the things that I would suggest is to give us a call, talk to a care consultant, so you can kind of lay out what works best for your family. And be able to make a plan to put that in place. There are lots of very simple technology that I think was mentioned. Something as simple as a shared calendar will keep everyone in the loop, making sure, or some kind of document if it's going to be a paper document that you have, but making sure there's an accordion folder that everything is clearly labeled. I think the most important thing for all of this is as you're developing this system of organization that you're not the only one who knows where the documents and everything is, that you're sharing that information with a couple of other people so that they know how to access it in the event that you need additional support in your caregiving journey. So just to tie it all together, I would suggest calling a care consultant to put a plan in place and to help to get yourself organized. But the most important step is once you've developed that system is to make sure you share it with other people so that they can support you on your journey.
Andrea, are you able to repeat the care consultant phone number for us? We have callers asking for phone numbers, or repeated phone numbers, please.
Yes, the number is 713-682-5995. Again, 713-682-5995.
Thank you. And Jennifer, we do have another follow-up question from Carrie. Carrie?
Hello. Yeah, this is Carrie. I don't know how many people out there are single caregivers like myself, caring for my older dad, but I have no backup. I live in a small town, and if I get sick or seriously ill, there's no help for me that I know of. The only thing I've been able to think of is hiring one of the in-home care services, but they want someone to commit to 20 hours a week of in-home care. Does anyone there have any suggestions for how to find someone to back me up for when I get sick as a single caregiver?
And Carrie, would you mind sharing what city you're in?
Kerrville.
Okay, Kerrville, Texas. Okay.
This is Andrea again. One of the suggestions, I grew up in a very small town, and that is exactly my mom was a caregiver. She had backup, but what they had to do was get backup for the backup, and they ended up doing that through community support and identifying people within the community that can support you and provide a backup for you. The other thing is to seeking out short-term respite options that may be of help to you. So local assisted livings, if they're there, or nursing homes sometimes will offer like a week's worth of respite. It does cost, and it may cost a little bit more because it's only a week, but you would pay by the night, and then that gives you some backup for yourself. So there's some practical things about asking neighbors, but the other is to look into the facilities around you to determine if they provide short-term respite, and then what that looks like and what the process is for getting him enrolled. So if there is an emergency and you need help immediately, you can enact it. So that would be my recommendation. And, of course, calling our caregiver, calling us or the Alzheimer's Association to learn a little bit more through our care consultants for support.
Thank you. Liliana, any more questions? Oh, sorry. Jorge, did you have...
Jorge, and so just to add a little bit, I want to remind you the Community Resource Finder website, communityresourcefinder.org, and of course AARP. You can also find it through there. But because you're in Kerrville, I want to encourage you to look into the caregiver support groups. Although they're, sometimes most of the people going there are people living with Alzheimer's, or one of their loved ones has Alzheimer's. There's a lot of value in going to those support groups because they oftentimes know what the resources are that you may not be aware of. And so even if you just visit with a local support group to learn from others, they probably can give you answers to what's local to you and, which resources are good and which are not so great as well, maybe. And so I encourage you to do that. It's a great way of connecting with the community who's caregiving.
Thank you.
Thank you. And there's
any more questions?
Yes. How would folks stay informed about caregiving best practices and updates?
So this is Veronica. If you are on Facebook, I love the Facebook group for that reason. It's around 30,000 different caregivers across the country with their own personal stories, their own testimonies, and their own shared wisdom. Right? What we find, is that as caregivers, we don't want to feel alone, and we also don't want this experience to be, something we just keep to ourselves. And so, once we learn something, we want to share it. And once we get something, we want to give it, and so it is, I would say, finding community and then talking with other caregivers is one of the best ways to find tips. And then I would encourage everyone to take a look at aarp.org/caregiving or aarp.org/cuidar in Spanish to see a lot of the articles, and it's how-to articles, it's tips, it's interviews with caregivers and their real stories and what they've learned and what's been helpful for them. So that's what I would offer from AARP, is the AARP Family Caregivers Facebook group, and then also aarp.org/caregiving or aarp.org/cuidar to engage with the content and how-tos from AARP.
Hi, this is Andrea from Care Partners, and my recommendation would be to our website has my recommendation would be to connect through webinars and different education events. Even if you're not in Houston, we have lots of webinars, and then most of our information will go on to our YouTube channel. So, again, visiting carepartnerstexas.org, there's a calendar of events for caregiver events, and it's not just particular to Care Partners. It is any caregiver events that we find that are going to be pertinent or that are sent to us that are pertinent for caregiving for people with dementia or older adults, and those resources are great ways to find different webinars to learn more about best practices or what's going on in the caregiving world. But attending webinars and education outreach. I'm going to pitch it to Jorge, because I'm sure the Alzheimer's Association have lots of things as well for you to connect with.
Thank you, Andrea. And again, because you are in Texas, I encourage you to just follow the pages of the local chapters. There are 6 chapters across Texas that from the Alzheimer's Association, and each one of us hosts caregiver conferences. We host caregiver conferences in partnership with Care Partners here in Houston. Sometimes they are virtual. And so if you have an opportunity to follow local chapters of the association, again, there are 6 of them. There's Austin, there's San Antonio, El Paso, Houston, Dallas, and then the Panhandle. And all of them host events all the time for caregiver support. Again, maybe the one that you fall within that jurisdiction in Kerrville is the Austin chapter. And so they may be hosting caregiver conferences, if not in Kerrville, maybe Fredericksburg or somewhere within driving distance. They may be of value. So I encourage you to do that. But we oftentimes have virtual conferences as well, at least once a year per chapter. So that gives you plenty of opportunities.
Thank you, Jorge. Thank you, everyone. So we're going to start to wrap up. On behalf of AARP Texas, I want to say thank you to everyone for taking part in today's telephone town hall discussion on caregiving and caring for family members with dementia also. We've been talking to 3 guests today, so thank you so much for all of you for joining us. As we near the end of the call, would any of you like to provide any last minute thoughts? We have about a minute for each person. So, Veronica?
Yeah, thank you. As we wrap up today's discussion, I want to leave you with a personal reflection, because caregiving isn't just something I talk about professionally in my work every day, but it's something I live every day. I mentioned that I'm caring for my 78-year-old mom and my 93-year-old dad, while also raising 2 young children who are 6 and 3. I'm 43, and my husband's also in his 40s. He actually had retinal detachment and had to have emergency surgery earlier last month. And so, the last month has really been an exercise in learning how to ask for help and recognizing that, these responsibilities are both rewarding and challenging at the same time. So, if you're feeling, deep connection and gratitude sometimes, but then there are other times where you're feeling completely exhausted and uncertain, just remember that you're not alone. And caregiving is not a one-size-fits-all journey. It is layered, it's complex, and it's deeply human. You are doing your best, and you matter, and how you feel matters. And it's why I feel like the work at AARP is just so rewarding. And we're here to make sure that you have the resources, support, and recognition that you deserve, whether you're caring for an aging parent, a spouse, or a child. I encourage you to think about how we can collectively create a culture that really values the work of caregiving and invests in your well-being and ensures that you never feel alone in this journey. So I invite you to just reach out and ask for help and share your ideas for how we can make caregiving sustainable, not just for families like mine, but for millions across the country. So thank you again for taking the step of joining this conversation and asking your questions. Thank you so much.
Thank you, Veronica, and thank you for sharing that personal story and what you yourself are going through. We appreciate you sharing that. Andrea, any last comments? We have about a minute for you here.
Yeah.
And if you could repeat the phone number, too.
I can. So I'm going to repeat the phone number before and after, but we were very heavy on the resources and talking about resource and connection, and those things are very important. But to wrap up, I want to give some reminders or some permission, and you to give yourself permission that, because I understand that caregiving can be all-consuming, right? It's what we do, what we think about. It's filled with routines, and sometimes in that routine, we really forget about us and taking care of ourselves. And a lot of times when we hear self-care, we're thinking about bubble baths, and we're being told to go for walks, and those things are a part of caring for yourself. But it's also part of remembering who you were before you started caregiving and giving yourself permission to enjoy those things and connect with those things. And maybe the plans have changed, but you do have an opportunity to say yes to small things in small ways so that you can pour your cup, pour into yourself as you're giving so much of yourself out in caregiving. So remind yourself and give yourself permission that self-care is not selfish. It's stewardship, it's respect, and it's discipline. And so making sure that you make some time for you. Remember who you were on this journey. The other part of that is Care Partners is here for you on that journey, here to give you some assistance and some support and help. So you're not alone. There are lots of organizations out there, Care Partners being one of those, who can help you. And so reach out to us if you need a break, if you just need an ear to listen to, or you need connection to a resource. Our phone number is 713-682-5995. That's 713-682-5995. And our website is Care Partners Texas, and Texas is spelled out, .org. Thank you all for hanging out with us today.
Thank you, Andrea. Jorge, any last comments? You have a minute.
Thank you, Jennifer. And similar to what Andrea is saying, my biggest advice for caregivers is that no one should face Alzheimer's disease alone or any other thing. Shouldn't face caregiving alone. There are 465,000 people living with Alzheimer's disease in Texas, over 1.2 million caregivers. And so there is a community out there of people caring for their loved ones. And so I want to encourage people to not feel overwhelmed and really go out and find their community. And then second, I want to acknowledge that caregiving doesn't end once one of our loved ones is no longer being cared for or they unfortunately pass away, that you are allowed to have those feelings and that you have to find yourself after they are gone from us. And so allow yourself that time to heal, both during the caregiving process and after. And please find your community. Do not go into any of this caregiving alone. There are thousands of people out here to support you, including organizations like the ones on this call. So thank you all for being here, and thanks for allowing me to be a part of this.
Thank you, Jorge. Thank you, everyone, for joining us. AARP wants to thank our guests, Veronica, Andrea, and Jorge, for participating in the event. AARP provides information and resources to help older adults and those caring for them. Thank you all for participating in the discussion on this important topic. We apologize if we were not able to answer your question. If you stay on the line, you will be able to leave us a voicemail with your question or comment. You can also obtain valuable information through AARP publications on our website at aarp.org or aarp.org/San Antonio. /local, or by calling 1-866-227-7443. AARP is urging Congress to pass a credit for caring tax credit for family caregivers. The $5,000 tax credit would put money back into pockets of hardworking family caregivers. It can help them remain in the workforce while juggling family caregiving responsibilities, and it lets Americans keep more of their money, their own money. Visit aarp.org/caregiving. That's aarp.org/caregiving to find caregiving news and resources. And there's information at aarp.org/caregiving about how you can send a message to Congress urging passage of credit for caring tax credit. Thank you, everyone, and goodbye.